My name is Robert Palmer, and I'm a general surgeon here at the Toledo Clinic. General surgery basically encompasses a lot of belly surgery, a lot of breast surgery, a lot of cancer surgery, a lot of lumps and bumps, and endoscopy. Today I really want to kind of get an idea or give people an idea about robotic incisional hernia and what it has to offer patients. Robotic incisional hernia, a lot of people have a misconception in the community regarding what robotic surgery actually is. Robotic surgery really is surgery that's performed laparoscopically with robotic assistance. And what that means is it's really an adjunct to laparoscopic surgery that we're already doing on a daily basis. What robotic surgery allows us to be able to do is use the robotic technology with wristed instruments to be able to do procedures that we otherwise wouldn't be able to do laparoscopically. This includes anything from bowel surgery to hernia surgery, including complex hernias. The advantage of laparoscopic or robotic-assisted laparoscopic surgery is it allows us to better visualize, to be able to do those more complex cases. Really, with any sort of laparoscopic surgery or robotic surgery, the critical part of the procedure is being able to get into the patient's abdomen so that you can blow their belly up full of gas to create a space to work. And once we're typically able to do that, we're typically able to complete a procedure laparoscopically or robotically. What robotic surgery allows us to be able to do is to actually sew inside the patient's abdomen. So the instruments that we use robotically are actually really an extension of our fingers. We can do very fine surgery. We're looking through a high definition 3D camera, which gives us better visualization to the abdomen. And we can do this through minimally invasive techniques, which basically means we're doing very small incisions as opposed to bigger incisions that patients are used to. What this allows us to be able to do is this allows us to get patients back to their normal activity quicker. There are certainly still activity restrictions that patients have with surgery, with any surgery, and discomfort, but we also help to minimize the discomfort with those smaller incisions. When people have the conception of robotic surgery, what they need to understand is the robot is not doing the procedure. The surgeons are doing this procedure. It's really, again, getting access to a patient's abdomen, and then the surgeon steps away to a console where we're operating the robotic arms. So it's not a robot, again, that's doing this procedure. It's all the surgeon guiding the robotic arms. We can do extremely fine detailed surgery. We can use multiple different types of instruments to be able to manipulate tissue. The technology is actually evolving to the point where we can actually sense how hard we're pulling on tissue, stapling devices that actually sense how thick tissue is and tell us that, oh, nope, you need a thicker staple load to be able to come across this tissue safely. So it's really an evolution over time. The way that I think about robotic surgery is it's really an adjunct to laparoscopic surgery that we're already doing. It just has all kinds of advantages for patients, from pain control to smaller incisions, getting them back to their lives quicker, less scarring, and I think it's a better surgery for a lot of patients. The risks are all inherently about the same as far as the risks of any procedure. The big caveat with robotic surgery, and obviously not everybody is a candidate for robotic surgery. We have to be able to see to safely do a surgery robotically or laparoscopically. And so anytime I ever talk to a patient about a robotic or a laparoscopic surgery, I always talk to them about the possibility of needing an old-fashioned incision if their safety requires us doing that. The majority of the surgery done robotically from a general surgeon's standpoint are incisional hernias. We do gallbladders. We actually do single-site gallbladders robotically, which is just done through one small incision at the belly button as opposed to the typical 4 small incisions. And we also do colon resections, bowel resections, splenectomies. There's just about anything within general surgery. As long as we can see, we can typically do it robotically. Limitations of robotic surgery certainly are the ability to see. In patients that have had multiple prior abdominal surgeries, if you have limited ability to get access to somebody's belly, if you're not going to be able to see to safely proceed, those are the patients that sometimes can be a little bit more difficult to safely do the surgery robotically. Recovery time, usually with most minimally invasive procedures, the recovery goes from an order of weeks down to 1 to 2 weeks. So where you had a hernia repair and you were 4 to 6 weeks out recovering from hernia surgery, usually you're down to a week or two. As far as discomfort, I think that's where patients really notice the biggest difference. Whereas when we did big incisional hernia repairs in the past, where people would be in the hospital for 3 to 5 days, they would have a lot of discomfort, potential wound-related issues with bigger incisions. These incisions are typically all closed with stitches on the inside, so there are no sutures that need to be removed or staples that need to be removed or any of the discomfort that's associated with that. Most are able to actually go home the same day as opposed to staying overnight or staying in the hospital for multiple days. But at the most, usually it's an overnight stay and they're home, back in their own bed. Toledo Clinic and Toledo Clinic surgeons really have been a forefront as far as robotic surgery in the city of Toledo. We were early adopters to the robotic technology. I think that the breadth of the robotic experience that we offer our patients is unparalleled in the Toledo community.